Hey there, it's Dr. Appleraju, your downtown digital general dentist. And today I wanted to talk a little bit about tooth crowding and why it's significant for your overall health, but also your oral health. What we see over many, many years and through thousands of patients is that when you have tooth crowding, if you notice, just look in the mirror, if you see your teeth are overlapping and they're not properly positioned, well, you're typically at a higher risk for a number of conditions. One of them being gingivitis, possibly gum disease, meaning periodontitis, but also it's hard to clean. You're at higher risk for tooth damage, tooth wear, tooth chipping. If you're noticing some of that happening to you, it could be related to that. On top of that, possibly from clenching or grinding your teeth, especially when you sleep, when the forces are significantly higher. But this is typically what we will see. But there are some other subtle things that could be happening. If you have really dark circles under your eyes, whether it's yourself or your loved ones, perhaps your kids, it's something we're checking for when you come in for a full checkup. If you have crowding and dark circles, typically that means that your teeth are not positioned and you may be snoring or a mouth breather. It's normal for us to breathe through our nose. There's a reason that we breathe through our nose, and there's a number of those, but I won't get into that right now. But it is normal for you to breathe through your nose. So if you or a loved one has your mouth wide open and you're mouth breathing, you tend to be a high risk for dental decay, dry mouth, this sort of thing. But also it's a possibility that you may have really bad snoring or possibly obstructive sleep apnea. You see, when you have crowded arches, you don't have enough tongue space. Your tongue is a big, powerful muscle, and if it doesn't have enough space, well, you're forced to open your mouth and breathe, especially when you're asleep. And this is where the snoring or possibly obstructive sleep apnea will come in. When those arches are very narrow and crowded, typically when you're relaxed and you lie down, your tongue is forced backward because of gravity. It doesn't have the space to expand around where the teeth should be. So teeth that are straight up and down like this, parallel, for the most part, allows the tongue more space. But when they're all tipped in, especially in the lower jaw, but they do function together, well, your tongue doesn't have the space, and this can cause some health problems, overall health problems, including inflammation and infection. So if you're at higher risk for gingivitis or gum disease because of crowding, and now you can't breathe properly, you tend to have what we call whole body inflammation. And this is typically the gateway. This is why we say the mouth is the gateway to your overall health. Because if you have these conditions, well, it's affecting your whole body. Inflammation is not a good thing, whether it's happening because of your mouth or other health problems, but it can exacerbate whatever runs in your family history and your genetic line. So whether it is heart attacks, strokes, cancer, arthritis, Crohn's, colitis, any of these conditions that we say are inflammatory in nature, this is typical of the diseases of aging, chronic diseases of aging. So your mouth plays a big role in this. And I hope this video will help you understand that crowded teeth are not just a minor problem. They can be a major problem for some people. And if you want to be assessed further, we'd love to see you in our clinic. You can certainly reach out to us by calling on telephone, or you just go to our website, www.conceptdentalreddeer.ca, and hit the little book now button. It takes about 2 minutes, and we'll get you in directly that way. And you can do that 24 hours a day, any time of the week, and we'll get you in our schedule, and then we'll reach out and confirm that with you. So if you found this video enlightening or informative, we would appreciate you hitting the like button. If you think somebody needs to hear this, perhaps share it with a loved one. Ideally, we'd love to see you as a new patient if you have not been in our clinic. If you have another dentist, we'd love that you get assessed for some of this, what I'm just talking about. In the meantime, stay well out there, and we would love to see you, and keep well. Take care.